Good morning, everyone, and welcome. My name is Dr. Methew, and for more than 25 years, I have treated thousands of patients suffering from knee pain, people just like you. Some were 50, some were 60, some were even 75, and almost every single one of them came to me with the same fear. They would sit in front of me and say, "Doctor, is surgery my only option now?" Today, before we talk about exercises, before we talk about remedies, I want to tell you something very important. Most knee pain does not require surgery. Yes, you heard that right. In fact, in my entire career, more than 70% of patients who were told they needed surgery improved without ever going into an operating room. But here is the problem. After the age of 50, people start believing a dangerous lie. They believe that pain is normal. They believe that damage is permanent. They believe that once the knee starts hurting, nothing can be done. And that belief alone destroys more knees than age ever could. Let me ask you a simple question. When did your knee pain really start? Was it after one bad movement? After sitting too long? After gaining some weight? After climbing stairs? Most of the time, knee pain does not begin because your knee is finished. It begins because your knee is irritated, inflamed, overloaded, misused. But irritation is not the same as destruction. And this is the first truth I want you to understand today. Your knee is not old. Your knee is just asking for help. Every week, I meet people who say, "Doctor, my X-ray shows arthritis. Doctor, my cartilage is gone. Doctor, my neighbor had surgery, so I will also need surgery." And I always tell them the same thing. An X-ray does not show pain. An MRI does not show suffering. Two people can have the same scan. One has terrible pain, the other has no pain at all. Why? Because pain is not only about damage. Pain is about inflammation, muscle weakness, stiff joints, poor movement habits, and wrong daily activities. And the good news is, all of these can be improved at home. Now, I want to speak honestly with you. Surgery is sometimes necessary. There are cases where surgery saves quality of life, but surgery should always be the last option, not the first. Unfortunately, in many places, people are told very quickly, "Your knee is bad, you need surgery," without trying proper movement, simple therapy, lifestyle changes, home-based treatment. Let me share a real story. A 62-year-old woman came to me. She could barely walk. She had knee pain for 3 years. She was told by 2 doctors that surgery was her only hope. She was scared. She was depressed. She thought her life was over. We did not do surgery. We changed how she sat, how she walked, how she slept, what she ate, and how she moved every day. After 4 months, she walked into my clinic without a stick. No surgery, no injections, just the right care. And this is why I made this video. Because too many people over 50 are losing hope too early. They think, "I am old now. Pain is normal now. This is my life now." No, pain after 50 is common, but pain after 50 is not normal. And more importantly, pain after 50 is often reversible. Your knee is a living joint. It responds to movement, blood flow, nutrition, and proper use. When you stop moving because of fear, the knee becomes weaker. When you rest too much, the muscles shrink. When muscles shrink, pressure increases. When pressure increases, pain increases. It becomes a vicious cycle, and many people are trapped in that cycle for years. Today, I want to break that cycle for you. Before we talk about surgery, before we talk about injections, before we talk about expensive treatments, I want to show you something simple. There are 3 home remedies, not magic, not dangerous, not complicated. Simple methods that reduce swelling, improve movement, strengthen support muscles, and protect your cartilage. Methods that I personally recommend to my own patients. But before I show you those remedies, I must warn you. There is one common mistake that almost every knee patient makes, a mistake that slowly damages the joint every single day, a mistake that cancels the effect of every exercise, every medicine, and every therapy. And most people don't even realize they are doing it. In the next part of this video, I will show you the 3 simple home remedies that reduce knee pain naturally, and the one mistake you must stop today if you want to avoid surgery. So, if you are over 50, if your knees hurt when you walk, if stairs scare you, if you are afraid of surgery, stay with me, because what I'm about to show you may change the future of your knees. Now that you understand why surgery is not always the answer, let me show you the simple home remedies that I recommend to almost every patient with knee pain. These are not expensive, they are not risky, and most importantly, they work when done correctly and regularly. The first remedy is something very basic but very powerful: warm and cold therapy. Most people use this wrongly. Ice is not for stiffness. Heat is not for swelling. When your knee is swollen, warm, or recently painful, you must use cold therapy. Take an ice pack, wrap it in a thin towel, and place it on your knee for 10 minutes. This reduces inflammation. This reduces pressure inside the joint, and when pressure goes down, pain goes down. Heat is for stiffness. If your knee feels tight in the morning, if bending is difficult, if the joint feels rigid, use warm therapy. A warm towel or heating pad for 10 minutes improves blood flow and relaxes tight tissues. Second remedy: gentle daily movement. This is where many people make a big mistake. They think, if I move, I will damage my knee more. So they stop walking, they stop bending, they stop using the joint. But the knee is like a machine. If you don't use it, it rusts. When you stop moving, muscles become weak, blood flow reduces, joint becomes stiff, and pain increases. I always tell my patients, rest is medicine for one day. Movement is medicine for life. Simple movements are enough. While sitting on a chair, slowly straighten your leg, hold it for 5 seconds, slowly bring it down. Do this 10 times, twice a day. In bed, gently bend and straighten your knee. No force, no pain. Movement sends nutrition to your cartilage, and cartilage needs movement to stay healthy. Third remedy: reduce inflammation through food. Pain in the knee is often pain from inflammation, and what you eat every day controls inflammation. There are 3 foods I strongly recommend: fatty fish like salmon or sardines, nuts like walnuts and almonds, and vegetables like spinach, broccoli, and carrots. These reduce swelling naturally. And there are 2 foods I warn my patients to limit: sugar and fried and processed food. These increase inflammation and make pain worse. Many people are surprised when I tell them, sometimes the problem is not in your knee, the problem is on your plate. Fourth remedy: body weight control. Every extra kilogram of body weight puts 3 to 4 kilograms of pressure on your knee while walking. Even small weight loss makes a big difference. Losing just 5 kilograms can reduce knee pain significantly. Now, I want to be very clear. These remedies do not work in one day. This is not magic. This is healing. When done daily, when done patiently, when done correctly, most people feel improvement within 2 to 4 weeks. But there is something very important you must know. You can do all of this perfectly and still fail, because there is one daily habit that secretly destroys your knees. A habit that almost every patient over 50 has. And unless you stop that habit, no exercise, no diet, and no therapy will save your knees. In the next part, I will show you the biggest mistakes that worsen knee pain, and the simple daily routine that protects your knees for life. Stay with me, because this part can save you from surgery. Now, before we end this video, I want to talk about the most dangerous part of knee treatment. Not exercises, not food, not age. I am talking about mistakes. Because in my experience, most knee pain does not become serious because of disease. It becomes serious because of daily wrong habits. Let me show you the 4 biggest mistakes I see every single day. The first mistake: too much rest. When people feel pain, they stop moving. They sit all day. They lie in bed. They avoid walking. They think they are protecting their knee, but in reality, they are weakening it. When you rest too much, muscles shrink, joints become stiff, support becomes weak, and pain slowly increases. Remember this: rest is for injury, movement is for recovery. The second mistake: wrong footwear. Many people wear hard slippers, old shoes, flat sandals, or worn-out soles. Bad shoes change the angle of your knee, and a small angle change creates big pressure inside the joint. I always advise soft sole, good arch support, no very high heels, no very hard base. Your knees feel what your feet wear. The third mistake: sitting too long in one position. Long sitting is poison for the knee. When you sit with bent knees for hours, blood flow reduces, joint becomes stiff, muscles tighten, pain increases when you stand. Simple rule: every 30 minutes, stand up, walk for 1 minute, straighten your legs, move your joints. Small movement saves big pain. The fourth mistake: sudden heavy activity. This is very common. People do nothing for weeks, then one day they walk too much, climb many stairs, lift heavy weight, or exercise too hard. The knee is not ready, and pain starts again. Progress must be slow and steady. Now, after telling you what to avoid, let me give you a simple daily routine to protect your knees. Morning: before getting out of bed, bend and straighten your knees 10 times. Gentle movement to wake the joint. Daytime: walk lightly for 10 to 20 minutes on flat ground, no rushing, no pain. Evening: chair exercises, leg straightening, light stretching. Night: if there is swelling, use ice. If there is stiffness, use heat. This entire routine takes less than 30 minutes a day, but when done daily, it protects your knees more than any medicine. Now, I want to say something very important to you. Age does not destroy your knees. Neglect does. Fear does. Wrong habits do. Your knee is not a weak joint. It is a joint that needs movement, care, and patience. Surgery is not your destiny. Pain is not your future. Healing is possible. And I want to end with this line: pain is a warning, not a life sentence. Treat your knees today so they can carry you tomorrow. Thank you for watching. Take care of your knees and take care of yourself.